Welcome to the RFMCF website. In part 1 of this video, we'll talk about in-hospital cover, ambulance services, and major medical services. In part 2, we'll talk about out-of-hospital cover for medical services for RFMCF members and their registered dependents. In-hospital cover refers to medical services related to hospitalization, which means being admitted to a hospital or healthcare institution for medical treatment. Hospitalization includes hospital ward accommodation covering general, high care, and ICU ward. Private wards will not be paid for. Emergency room or casualty visits at the hospital that result in hospital admission. Please note that all admissions are subject to pre-authorization. Emergency room or casualty visits at the hospital that do not result in hospital admission are payable from the available day-to-day benefit. Prescribed medicines on discharge are limited to a 7-day supply of medicines upon discharge from the hospital. Dispensing fees may apply. Radiology, which refers to basic X-rays, are payable from the hospital authorization. Pathology is payable from the hospital authorization. Subacute facilities, referring to step-down facilities or private nursing and wound care, are subject to pre-authorization. Note that the South African Military Health Service remains the primary healthcare provider for all hospital treatments for RFMCF members and registered dependents. If the member visits a SAMS facility and hospital admission is required, the SAMS will arrange pre-authorization from the fund. If the member visits a private practitioner, either the doctor's rooms will arrange pre-authorization from the fund, or the doctor's rooms may ask the member to arrange pre-authorization themselves with the information provided by the treating provider. Private hospital admissions are subject to the use of a designated service provider and pre-authorization by dialing 012-679-4201, emailing preauth@rfmcf.co.za, or faxing the required information to 012-111-9068. For more information about hospitalization, please read the benefits infographic and schedule of benefits found on the RFMCF website. Ambulance services. ER24 is the designated service provider for RFMCF members. Contact ER24 on 084124 to obtain pre-authorization. DD 2703 is required for the use of ER24. If a non-DSP is used, the member will be liable for the full amount. Major medical services. In contrast to day-to-day medical healthcare needs, such as visiting a doctor or a dentist, there are sometimes medical events that are more serious and costly. These would be, for example, rehabilitation after a car accident, treatment for cancer, and other medical treatments. Not all of these services take place in hospital. For example, many of the expensive treatments for cancer under the oncology benefit take place out of hospital. This refers to major medical services. Major medical services are subject to using a designated service provider and pre-authorization by dialing 012-679-4201 or emailing preauth@rfmcf.co.za. For more information on major medical services, please explore the benefits infographic and schedule of benefits found on the RFMCF website. Please remember that the SAMS remains the primary healthcare provider for all major medical services for RFMCF members and registered dependents. Now let's talk about out-of-hospital cover. Out-of-hospital cover refers to benefits for medical services that are not related to hospitalization. These services relate to in-room consultations, optical benefits, dental services, preventative tests, medication and out-of-hospital medical appliances, supplementary and auxiliary services. When medical treatment is outsourced, the SAMS must provide the member with a DD63 before the member visits the outsourced service provider. This DD63 must be handed to the outsourced provider. Medical treatment outsourced by the South African Military Health Service will be processed according to the available benefit allocation. Day-to-day healthcare services include general practitioner consultations, in-room procedures and consumables. Specialist consultations, in-room procedures and consumables. Psychology or psychiatry consultations that take place out of hospital. Radiology and pathology that take place out of hospital. Specialized radiology, which includes MRI, CT scans, and radioisotope, both in and out of hospital. Acute medicine, including dispensing GPs. And chronic medication. The South African Military Health Service remains the primary healthcare provider for all day-to-day services for RFMCF members and registered dependents. If outsourced by the SAMS, you are encouraged to use the RFMCF GP and Specialist Network, a list of healthcare providers in your area. Should your benefits become depleted, you may still make use of the South African Military Health Service for medical treatment. However, after depletion of benefits, outsourced services will be for the member's account. For more information on the limits that apply to all out-of-hospital outsourced services, please explore the benefits infographic and read the schedule of benefits found on the RFMCF website. Out-of-hospital medical appliances, supplementary and auxiliary services. Out-of-hospital medical appliances, supplementary and auxiliary services include auxiliary services, audiology, physiotherapy, podiatry, dietitian, occupational therapy, speech therapy, general medical and orthopedic appliances, incontinence products such as adult nappies and catheters, hearing aid appliances which must be prescribed by an ENT specialist or an audiologist, home oxygen, CPAP machine, and stoma therapy. The SAMS remains the primary healthcare provider for all medical appliances, supplementary and auxiliary services for RFMCF members and registered dependents. These benefits are subject to the available limits and use of a designated service provider where applicable. For more information on out-of-hospital medical appliances, supplementary and auxiliary services, please read the benefits infographic and read the schedule of benefits found on the RFMCF website. Optical services. Optical services include optometric examinations, lenses, frames and contact lenses. Optical services are managed by Opticlear and not through the SAMS. Members must obtain authorization for services from Opticlear by dialing 012-679-4200. If benefits are available, a unique pre-authorization number will be provided. Please note that a pre-authorization is not a guarantee of payment. Claims without prior authorization will be rejected and will be for the member's own account. For more information on optical services, please explore the benefits infographic and read the schedule of benefits found on the RFMCF website. Dental services. Dental services include basic and specialized dentistry, orthodontic treatment as well as surgical dental procedures in hospital. The SAMS remains the primary healthcare provider for all dental services for RFMCF members and registered dependents. Private dental treatment is subject to pre-authorization provided by the SAMS by means of a 2703 form if treatment is received outside of the SAMS. For more information on dental services, please read the benefits infographic and schedule of benefits found on the RFMCF website. Preventative services. This benefit relates to outsourced preventative services. These tests are crucial as they can uncover underlying health risks, allowing beneficiaries to take the necessary steps to prevent future comorbidities. For more information on preventative services, please read the benefits infographic and schedule of benefits found on the RFMCF website.